Hey guys, welcome to episode 7 of the Treasures of Public Health History series with the Plague Professor. So, today I'm going to talk to you a little bit about germ theory and when hand washing was an act of rebellion. Since I know hand washing is something we should all be acquainted with these days, so keep it up, stay safe, stay healthy. So I've told you a little bit about germ theory in the episode about Pasteur, so I'm going to expand a little bit more on that today. But before I do, let me just explain two important sort of side notes or caveats. So number one, when we think about germ theory as the basis of scientific medicine, that it's kind of at the core of Western theories of medicine, it does kind of privilege Western medicine, or it makes us think that Western medicine is the sort of absolute truth or the best system, most superior system of knowledge when it comes to science and medicine. And keep in mind that other systems of knowledge actually did anticipate germ theory long before it was discovered by the West. So the Abbasid Caliphate in Baghdad, for instance, also scholars in India, scholars in China, just to name a few. We're going to come back to that another day because I don't really have time to get into it today. The second caveat is that we often think about medicine as adhering to this sort of linear mode of progress, that it sort of keeps getting better and better and better. Well, in fact, there are some hits and misses along the way in science, just as there are in almost every other field. So this is particularly true of germ theory. So that's what I'm going to tell you about today. So listen and learn. So you probably figured out that these funky looking things are germs. And we know that germs like these cause disease. And that's the basis of germ theory. That's pretty much it in a nutshell, is that microorganisms cause disease. We take that for granted, but keep in mind that the adoption of germ theory wasn't automatic. It was actually a process. So if we want to understand the formal adoption of germ theory in the 19th century, if we're sticking to that narrative, there are three main figures. So the first I've already told you about in a previous episode is Louis Pasteur, the French chemist who determines, based on his research into fermentation, that little microorganisms cause fermentation and putrefaction, which enables him to develop pasteurization so that we can now drink safe milk. There is also Joseph Lister, who's a contemporary of Pasteur. So he was like maybe 5 years younger than Pasteur, but he was a British surgeon. And so he is influenced by Pasteur's ideas and applies them to medicine and specifically to surgery. So this strange looking contraption is a device that Lister developed to spray an antiseptic into the surgery room and also to use in wound dressings. Now, the antiseptic he chose to use was carbolic acid, which kills germs, but it's also not particularly good for you or for your skin. But it was a good place to start. So this is kind of how that contraption would be used in the operating room. As you can see in this illustration, it's perched on the bedside of the patient and it issues a continuous stream of antiseptic. So you might be surprised that I referred to this as a surgery room or an operating room, but that's pretty much how surgeons operated in the 19th century. As you see, they're in their street clothes. There's curtains on the window. It just kind of looks like almost like a lunchroom at somebody's workplace, except that they're operating on a patient. So the third person associated with this formal adoption of germ theory of contagion was a German professor of public health named Robert Koch, who builds on Lister and Pasteur's foundations and in the 1880s comes up with a series of postulates that it basically formalizes germ theory and creates a sort of evidence-based model. So for example, one of the postulates or the rules of this model is that, if you're going to link a particular germ to a disease, if you're trying to claim that this germ causes diseases, well, then you have to find that particular germ in every single case of the disease. Stands to reason. So this all sounds very logical, and it also sounds very logical by extension that if we understand germs cause disease, then of course we would all want to wash our hands. Except that it was only about 4 decades before Cook came along. So in the 1840s, when a Viennese doctor named Ignaz Semmelweis was actually fired for telling doctors they should wash their hands. He was considered really subversive and kind of radical and a revolutionary. So let me tell you a little bit more about Semmelweis and the rebellious act of hand washing. So this is Dr. Ignaz Semmelweis, who in 1841 was hired to run a maternity ward in a Vienna hospital. And he noticed that the maternal death rate at that hospital was significantly lower in the ward run by midwives when compared with the ward run by doctors. And the one difference he noticed between the midwives and doctors is that the midwives typically washed their hands after tending to patients, whereas doctors did not. And so he concluded that there must be some sort of invisible agent that was causing these deaths, and that hand washing somehow prevented it. And so he actually started washing his hands, and he used a solution of chlorinated lime water as an antiseptic, and then started requiring doctors in the doctor's ward to wash their hands with disinfectant. After he instituted that hand washing measure, the death rate in the doctor's ward actually dropped by 2/3. So you would think that this was a tremendous success and that he would be celebrated as a hero. Except that he was not. In fact, doctors who were required to wash their hands strongly objected, and in fact objected so strongly that Semmelweis was ultimately fired and shunned from every single hospital in Vienna, which goes to show that often these scientific breakthroughs, like germ theory, they take time. It's a process of being adopted into the sort of conventional wisdom. So the moral of the story is just, I guess, be glad that you don't live in the 19th century. All right, that's it for today. Plague Professor out. Keep washing your hands. Stay safe. More another day.